All right. Good evening, man. I swear these days are getting longer and longer now with COVID. So it was a good morning earlier today. People see us again. Good evening. Welcome to the very first episode of the Converge Media COVID Update Show. This is the brainchild and passion of producer Nikki Barron. And a lot of people might remember that actually the morning update show, anchor show on Converge Media, it started back in March. As a way to be able to get some of the best information out there to members of our community about what was going on with COVID. So really proud that we've gone from the morning update show to now be able to ramp up with the COVID update show. I know it's not very creative with the names, but with the COVID update show and be able to get as much information that's curated for our community out there. And that being said, Nikki Barron, tell us what this show is all about.
Hey. So the COVID update, it's just a quick, we want to keep it short and sweet and dive into one topic each time, Mondays and Wednesdays at 6:15, just around COVID. So talking about the numbers, the cases, the progress that we're making on vaccines, talking about resources for people, for people who are struggling during the pandemic lockdown. So it's really an opportunity for us to give a targeted bit of information that will hopefully help us stay safe and healthy and thriving. So that's the whole point of our show. I just wanted to throw out a disclaimer, though. I'm not a doctor.
Me neither.
That. And although many of our guests may be, I just recommend that anything you hear here on the show, if you're going to make any changes to your medical routine or health routine, just to run that by your doctor, because I am not your doctor.
I only play one on TV.
Yes, I only play one sometimes on TV. So, today, I'm really excited because we are actually going to be joined by our first guest, Jennifer and James, and they're from the Elson S. Floyd College of Medicine at the Washington State University. And they
hold on. Did you say Washington State University? As in Cougars?
Yeah.
Man, we might lose some viewers today. This is good stuff. Good stuff. We're happy to have them with us.
Yeah, and I actually found them because I follow their account. It's on Instagram. It's at Let's Talk COVID WA. And this Instagram account is all about making the information and data for COVID in Washington more accessible. So I love the way they kind of serve it up. They give us an update each day, Monday through Friday, and it's a really digestible, easy to understand graphic that keeps us informed. So I thought they might make a great guest because I talk a lot of numbers on the morning update show when I talk about COVID. I know it's been a learning curve for me, not as a data person and not as a doctor, to learn about this. So I'm really excited to bring them on here in a few minutes. But I wanted to start out first by talking about our COVID numbers. So if you watch the morning update show, you got some COVID numbers this morning. And they actually don't update the numbers over the weekend. So I have the more accurate numbers now because they just released them about 5 o'clock today. So we saw I'm going to pull up my first clip here. So we are now at 147,537 cases, which is about a 6,000 % increase for confirmed cases. We saw an increase of 331 for hospitalizations. And we saw an increase of 36 for deaths here in Washington State.
Okay, jump in here real quick, Nikki. And I think that when people, so one of the big things that people talk about is COVID having people testing a positive for COVID because they're like, yeah, there's more tests out there, which is true. There is way more testing than there was. But an important number that you just bring up is hospitalizations. And you said that's on the increase.
Yeah, so hospitalizations are on the increase and is predicted to increase dramatically. Hospitals are already making changes to elective surgeries because they're expecting the influx to increase so much. And outcomes have gotten better with hospitalizations because they've been able to learn a lot about how to treat COVID patients. But it's still not a foolproof treatment plan. So hospitalizations are a really important number to watch. So yeah, and we saw an increase of 331. And so that's pretty scary. That's just since Friday. So.
And that's across Washington State?
Yeah, that's across the state of Washington. Yeah.
I won't take up too much of your time. I just want to put this back up here real quick. But we see King is in there and Pierce and Snohomish, which are, pretty big hospitals and everything else. Those tri-cities there, that's either like Benton County or Franklin County. Then also you got Spokane. It looks like the Palouse looks like Pullman up there as well and shaded in. And some of these other counties bring that up. It's like, for when you talk about an increase in hospitalizations, somewhere like Seattle or Tacoma or Everett might be able to take that somewhat. But some of these other counties that are out there in the state, not very big ICUs. The hospitals aren't really ramped up for surges and hospitalizations.
Exactly. And there's no, for a little while there was a little wiggle room, and we had travel nurses and travel doctors that were kind of moving from hotspot to hotspot. The whole country is lit up. So there's nobody coming to help us, So what we have is what we have. We've increased a lot of the supplies and things like the respirators to help people breathe and treatment. But there's never enough. There's never going to be enough to handle everything. So it's super important that we're masking up and staying home if possible, because we want to stay out of the hospital if possible.
Of course. Yeah. What else you got for us?
So that's all I have as far as the data goes. And then I want to, take a quick break here and bring in our guests that can help us understand this data a little bit more.
All right. Well, you're right there. Let's take a short break. We come back. We've got James and we've got Jennifer, and they're talking about data that's digestible on Instagram and some everything else. You're watching the COVID Update Show. All right. And see, I figure this out. You can tell it's first episode because I got COVID update, coronavirus update. But it's just all bad, man. It's just 2020 on them. You know what I'm saying?
Yeah.
So we're back here, and we got some guests. So I'll let you do the introductions here, and I'll pull them up on screen.
Yes. First guest, we've got James, and we have Jennifer, and they are both students at WSU. Welcome.
Hello. Hi, thanks for having us.
Awesome. So let's dive right in. So tell us a little bit about the account and the goal and who's behind it.
Yeah. So I guess who's behind it? We're medical students, like you said, from WSU College of Medicine. And I think it's important to make the distinction before we go any further that this information is 100% student created. So it's not information that's been analyzed or kind of official from the medical school. But this is just created by us students based on publicly available information like the COVID dashboard that you just pulled up. And so how it started, I guess, was, as a medical student, I think I realized it's really easy to be completely engrossed in your studies. And at some point a couple months ago, I just felt like I was losing sight of the reality of the pandemic. And so that led me to just want to understand our numbers better and just how we were doing in Washington State. So I went to the COVID dashboard through the wave, and I just kind of felt like the information, while it was there, was not the easiest to understand. I felt like it did take a little bit of number tracking or number analysis to kind of understand how we're doing in terms of our cases or our percent positive, for example. And so that led me to kind of start this Instagram page. Our goal is to post these daily stats, showing people how we're doing in terms of the numbers, which I hadn't even realized they had updated at 5 p.m. So I have to go and do that later. But yeah, we want to do that. And then we've also been trying to raise awareness on some of the health disparities that have been magnified by the pandemic. And then most recently also our COVID holiday post. It's all based on information that's available out there. We're just making it more available to the public.
Great. And I've actually got an example of one of these posts I wanted to show. So this is your post from Friday, and I love how simple and easy it is to understand. You can just go through your feed, you know, when you're laying in bed, and in the morning we're all scrolling through Instagram, and it's just right there, super simple. So how many students are behind the account?
There are 4 of us behind the account. Currently, we actually just added 4 new student leads from our first-year medical students, and so it's been fun kind of brainstorming ideas for future posts that we want to make together.
And James, maybe you can tell us a little bit about where you guys source the data.
Oh, James is on mute. There we go.
Right now?
Mm-hmm.
Perfect. All right. So we source our data from a variety of places. Our daily posts, the ones you're talking about that are updated each day, we get those from the Department of Health, the same site that we were on earlier from Washington. Some of the posts that we put together from other sources, and they're all peer reviewed. So for example, we use the New York Times COVID data repository for a few of them, and that's the same one that's used in that post by the Georgia Tech, the holiday post that you just showed. And that one also uses CDC data. So overall, we do use a lot of graphics from a lot of different areas. They all are peer reviewed, and they tend to be associated or affiliated with an academic institution for the most part.
Right. I got a question. You know, colleges, and you guys are there in medical school. Pullman, Palouse is a reputation. The party squad. I remember like a few months ago when everybody was kind of getting back on campus, and I had actually read one of the national newspapers that Pullman per capita per its size had like some crazy rate for COVID for because people were out and about, some everything else. Man, what is basically what I'm trying to say is that COVID is like hitting these colleges and universities and everything else. And I mean, what are some of the advice for people that are still on campus? Like my son, he's in school at University of Loyola in Chicago. All of his classes are online, but like people are still getting COVID there. But you know, at the college, he has friends out there who are still getting COVID. Is there any kind of advice for students? That's a tough life, trying to go to school, especially if some of your classes aren't online. I mean, what are some of the things people could do?
I mean, I think you've seen, I guess we just try to follow what the CDC is recommending, you know, what local officials are recommending. And so that's, you know, wear a mask, social distance. Right now, you know I'm following what Governor Inslee has put out about a week ago regarding like our more stringent lockdown measures. And I also think, you know, I think that's kind of the underlying motivation behind why we do what we do on the Instagram page. It's not to tell people to do something like with the holiday post that's been gathering a lot of attention. We're not explicitly telling people whether they should or should not meet with their families. We're just trying to help people make an informed decision. So, you know, if people don't know this information is out there, we're just presenting it to them. And at the end of the day, they still get to choose, you know, how they live their lives or what they do with their time. Hopefully, though, by presenting information from sources that we trust or sources that are reputable, we can help people kind of see kind of the information that's driving like policymakers' decisions right now. So yeah, wear a mask, when you can, wash your hands, just the things you've been hearing for the past couple of months.
Yeah, I think that's something I really like about your account is I know for me, it's my job to go to 4 or 5 different sources to find information about what's going on. But if you're just the average person that is not their job, an account like this is really helpful to just kind of stay in the, stay aware of what's happening. It's easy to just want to look away, but if it's, the data's right there in front of you, I think that's super helpful. So I really appreciate what you guys are doing with the account. I think it's really great. Yeah. So I had another question. What is talking about the data, and you guys put daily numbers up, but what is the number that's the most important? I mean, Omari and I were talking a little bit about that earlier. Like for us, we kind of focus on hospitalizations because I worry a lot about hospitals being overrun to care for patients. In your opinion, what's the most important number for Washingtonians to be watching when it comes to this COVID data?
Yeah, James and I were talking about this earlier. We don't feel like we can really say that one parameter is more important than the other, because I think everything kind of has its own implications regarding how Washington is doing in this pandemic. For example, I think people tend to want to focus on the daily cases that we have, which is obviously just how many people have tested positive for COVID in a given day. But I think it's also really important to look at the percent positive of tests. So that's how many tests are coming back positive out of all the tests that we're doing in Washington State. And what's interesting is we've been tracking this since, I guess, early September. And pretty consistently in November, you're seeing percent positives that are 7% or higher. So yes, we are testing more people, and yes, we are seeing more cases, but also our percent positive of all these tests has increased from back in September when we were at 3 to 4%. And so if you take all of that together, it potentially provides an explanation as to why we are seeing kind of more stringent lockdown measures in Washington right now.
Yeah, so you're saying we've doubled, kind of almost more than doubled the percent of positives in all the test results since September, and that's really what's triggering the lockdowns.
Yeah, potentially, I think. Yeah, and then like you were saying too, looking at hospitalizations, that kind of shows the burden we're putting on our healthcare system. And so I think for that reason, we can't really say that this is the most important number to look at, because they all kind of have their own meaning, and hopefully that becomes clear through our page too, why we care about more than just one number, I guess.
And so kind of on the flip side of that, do you find that there's one part of the data that tends to be misunderstood or used in a way to tell the story that's maybe not quite accurate?
Yeah, I can speak about that a little bit. So a while back, we did a post about prevalence in different counties and compared them within Washington. And one thing that was kind of confusing about that post for some people that we found was that even though in a county like King County, there were more total cases that were coming up, the graphic that we made took into account the populations for those different counties, and it showed rural counties having significantly more cases over time than urban counties in Washington. And so that question that we got was how come the total cases is higher in urban areas, but you're showing that the total cases for a given population size is higher in rural counties? And that's just that, there's more people in the urban areas. So even though there's more cases, the prevalence is actually lower. And that's just something that we found that we had to clarify and thought it was important to bring up.
So I had just one final question. So I noticed on your Instagram link, it actually takes you to a really interesting interactive assessment. And it's the COVID-19 event risk assessment planning tool. What was the motivation behind putting this link, and kind of what are you hoping people use this tool to accomplish?
So we hope that this tool, just like Jennifer was saying a little bit earlier, we think that there's a lot of really great data and a lot of really great analyses out there. So for this tool specifically, it was made by people over at Georgia Tech, Stanford, and I think one other group. Pull up the Applied Bioinformatics Laboratory. And so like, we aren't making these tools ourselves, but we know that it's difficult to find tools like this, and they're really great. They provide really great insight into how to make decisions and informed decisions yourself. So we just want to share these. This one in particular, like our post says, just gives you a sense of like, what are the chances of running into someone with COVID if you have a given group of people of a certain size. So I think, I'm sorry.
Omari, we want to zoom in on Washington for us, and we can take a look at some of these risks and kind of talk about those. I thought this was really fascinating when I first pulled this up, because a lot of people I know are just sort of moving forward with their Thanksgiving plans as if it's kind of everything is normal. And they really, now having this tool, it's really easy to just zoom right in on Washington and look, even if you don't leave, King County, if you have just 5 people or 10 people in your Thanksgiving dinner for King County, you're looking at a 12% risk.
Ooh, why is Chelan so high?
So if you scroll down on that bottom left side and you adjust that event size down to 10, and then you set that ascertainment bias to 10.
And what is that? What is the ascertainment bias?
Yeah, so the ascertainment bias is that's based on serological studies done by the CDC. And so what that essentially is if that's a 10, then that means that for every case that you're finding, like that you're confirming through like COVID testing, then there's 10 other cases estimated that are out there. And so there's a CDC serological study where they took different sites and then they compared that to how many confirmed cases they're finding. And the latest one that they did was their second phase study, and that was an ascertainment bias of 9 to 10 on average.
So essentially that means that we're not able to know everybody. Not everyone's being tested. So there's more people out there who have it than we know about for the data. So the data sort of plans around that. Is that what that means, if I'm understanding correctly?
Right. Yeah. Not everyone's being tested. So there's a number to estimate, how many more people are out there. And that's what that ascertainment bias is.
Cool. Yeah, I'm getting so much better at using data and like understanding these things just through this.
Honestly.
Yeah. So with that in mind, it's actually a 22% risk for King County for just 10 people that you're going to encounter so this is that you would encounter somebody who has it. Is that correct?
Right. It estimates like the chance that if you're in a group of 10, that one person in that group would have COVID. That is correct.
Wow. That's like almost a quarter. Like that's pretty scary. So you guys are in Spokane County. Is that right? What's your county? I want to look at your risk.
Our school is based
Whitman.
in Spokane, correct?
Let's go.
Okay.
Spokane.
36%. Wow.
That's that bleed over from Idaho, man.
Yeah.
Go across the border. Yeah, you go across the border, this and that. Like Idaho is lit up.
Yeah, Nez Perce, Idaho, 76% risk. Oh my gosh, that's really scary. Yeah, and you've got Adams right there
from
too.
Idaho. Yeah.
Yeah.
It's really interesting though, because you have people who are messaging us or commenting on the post that we made based on this tool, saying that they disagree with our presented risk of transmission. But again, like we aren't providing any information about how likely you are to get it if you meet in a group of 10. And so I think that's something that, as this page has been growing, we've had to talk about, how can we make information understandable to people, like ascertainment bias, like what is that? Somebody actually commented and asked if we could make that more clear in our captions, that people, if they choose to read our captions, so that they would understand, what that means. And so it's definitely been something we've been learning through as well. But it's been fun and hopefully helps people.
Yeah. Well, I mean, Omari, did you have any follow-up questions about
This is good. I like doing the show with you, Nikki, because the morning show, I'm always the one asking all the questions of the guests, so I kind of get to sit back here and watch you fire away. But no, this is great, and answered a lot of questions here, got a lot of good information. Also, Instagram is a format that it's digestible, and in a public health emergency, like we'd like to say, like, oh, people should go to the CDC and they should read it. Yeah, there's what people should do and then what people will do. And I think the fact that you're putting this information out there in a popular platform that's digestible, that it's easily shareable or repostable. People can add to their story, they can tag people. I think that's a really important part of it as well. And it's more powerful than just having a blog post, like, oh, we've updated our blog. Maybe somebody read, maybe they won't, but putting it there in the feed is important. And I think that your Instagram page is definitely one that we will elevate and boost from our side as well.
Yeah, thank you so much for putting that Instagram together. Great. All right, we're going to let you guys go and take a quick break and be right back.
You guys be safe out there.
You too.
Thank you.
Thank you so much.
Bye.
All right, welcome back. Converge Media Coronavirus Update Show. Man, I mean, we was talking about doing an evening news. This coronavirus is really like dictating our programming, like 100% over here, because we wanted to do a news show in the evening, and here's our evening news show, at least Mondays and Wednesdays at 6:15. I know we gotta get out of here, Nikki Brown, but man, let me bring this back. This was such an interesting thing here, huh?
Yeah, now I'm just going to spend my whole evening looking up where everybody I know lives and being like, you're 36%.
And that was like 10, but it's like I seen some stuff this weekend where you got like 20, 30 people together, man. And, like on Instagram and some of the other platforms, some events people are having. And I'm wondering what's going on in Chelan though, man. Like this is wild. Look at this.
I mean, so you have the event size pretty high, but if you drop 25. It down, but if you even at 10 people, it's 43%. Like I've tried to be like, okay, people are keeping it small, like just their, maybe grandparents, things like that. 43% in Chelan. That's too close to King County.
Look at you, get back, dog. Oh, look,
you guys better stay over there.
Yeah, but you see, so Idaho was going through it, and I mean, and what we're seeing too here, and zoom out real quick, is a lot of America that didn't get hit on that first wave, and there was a lot of discussion like, oh, it's just these states or those states. It was kind of like around a political line, to be honest with you. But it's good. It's good to see that. Well, it's not good to see, but I mean, we're able to see here how, unfortunately, coronavirus is. Man, it's really literally all across America.
Yeah, it is. And this, I think that, I hope that, Instagram accounts like this, can help people digest this information and make smarter choices. It is hard to stay home and not do big Thanksgiving. That's sort of my holiday. So I really feel this one acutely because I normally have a big Friendsgiving. I've been in Seattle for 10 years, but I've really made a family here with my friends for this holiday. And so I'm pretty bummed that it's just going to be me and my boyfriend. But looking at this tool, I mean, it's an easy choice. Looking at this tool, seeing those Instagram updates, it's an easy choice for me. I'll do Thanksgiving next year.
Right. Tanya asked, does it list Hawaii? That's why I was over there. I showed everybody Hawaii at 9%. We're proactive in the comments, man.
We should probably go through those comments real quick before we get going, just to see if there's any questions that didn't get answered.
A lot of stuff that just says Nikki is the bomb. Thank you, Nikki. This and that. Let's see here. Well, we've got one here, Angelina Lee. It's just like a plea here. It's like, I forgot we can also put them on screen here. As a nurse in a hospital and a daughter of someone potentially will need cardiac surgery, please, please, please wear a mask and observe the restrictions. There are many who have other health issues that won't be addressed due to patients needing care for COVID. Those with other medical issues will only get worse. I saw the backlash from the spring shutdown, which is true. There's a lot of other people they talk about elective surgeries, but there's just a lot of other people that as well that have health issues and emergencies and everything else. And when that hospital space is taken, it's taken. So
yeah.
we want to be aware of that. Now we got another show coming up on Wednesday at 6:15. You got a guest for that yet, or are we still looking?
We still haven't booked that one.
Okay. I got a good one for you then. Don't worry.
You know how it is here. It's rapid fire. So, but I'm looking forward to that one on Wednesday. And if you guys have specific questions, it can be about anything. Things I'm hoping to cover. Talking to people at the unemployment office about COVID, unemployment relief. Just trying to help people I know, because I'm pretty good with paperwork, like friends and things, get there. It's confusing. So I'm hoping to help find some answers to that. I'm hoping to pin down somebody to explain that process to us. I know that the governor just announced on Friday about some small business COVID relief, hoping to get somebody on the line for that. So it doesn't just have to be about data and the numbers. It can really be COVID adjacent, I guess. If you guys have questions, make sure you head to our website, whereweconverge.com, and you will see our COVID resources page. And at the bottom, there's a form there. Fill it out. Let us know what your questions are. I want to make sure that the show is helpful for you. And I'll put that link here in the comments. I've also linked the Instagram account for Let's Talk COVID Washington. And I've also linked this really scary risk assessment tool. So you guys can take a look at that and see your counties, or maybe use it as a way to convince your family and friends that it's not worth it. So.
Yeah, it's Thanksgiving, but compared to what, you know what I'm saying? Man, we gotta keep our people safe. That's for sure. Well, this is good. I appreciate Nikki Barron, the passion and the effort that you're putting around this and putting around getting this information out and everything else. And we're back again Wednesday at 6:15. Right?
Yes, we are.
Okay.
Yep.
Wednesday, 6:15. We'll be back here. This is a good episode, so I'm sure that Nikki is going to go and put it across the social platforms. It's a good episode to go and share with people, and also use some of the resources that you found here. We'll catch you on Wednesday. And if, like I said, if you have any questions about things, us, we like to track things down. We want to find out what's going on with unemployment. We want to find out what's going on with resources. We want to find out. So it's not all just the science around COVID, because clearly we know that COVID is impacting us on all different kinds of ways. So we want to be on top of that. Any last words before we get out of here?
No. Mask up, wash your hands, and tune into the morning update show.
That's right.
See me again, talking COVID again.
Again, come on, man. We got to stay on message. All right. Well, and if that's the case, then we're going to get out of here for now. And you can check us tomorrow morning, 11 a.m. morning update show. Till then, peace.